Hi, everyone, and thank you for joining us today for this presentation on participant retention strategies. My name is Dikla Blumberg. I'm the project director of the Clinical Coordinating Center for the CTN trials with the Emmes Corporation. What I really wanted to do is share a brief overview of the topic of retention in general, and then also in context of the CTN trials. As many of you know, the CTN is a network within NIDA that conducts studies of behavioral, pharmacological, and integrated treatment interventions in multi-site clinical trials for the treatment of substance use disorders. Retention is a really vital aspect of these clinical trials and a key factor in determining the success of any study. Despite its importance, retention remains challenging in randomized controlled trials. As we all know, and this is especially true for those of you who are study coordinators or are actively involved in managing a research site, it can be really difficult to enroll and retain participants in RCTs. If we look at existing literature in the topic, there are accounts of barriers to achieving high retention, which include a burden on participants, transportation difficulties, inconvenience of scheduling appointments, poor clinical staff engagement, which is definitely not true in the CTN studies, complexity of the study protocol, lack of awareness about clinical trials for patients, and even sociocultural issues that are related to trial participation. And this is among many other barriers that have been studied extensively for clinical trial participation and retention. If we look here at the data published by the Center for Information and Study on Clinical Research Participation, you'll see that only about 43% of participants are retained in a study for randomization to completion. So that is a very low number and not what we'd expect or want for our studies. And these data come from an aggregate of 3,500 phase 2 to phase 4 clinical trials from 2009 to 2013. It's vital to overcome these barriers in clinical studies due to the magnitude of the negative implications of low rates of retention. These may include, as you see here, longer duration of trial implementation and subsequent increases in cost and expenditure of resources. There are also consequences for data integrity, including lower statistical power for the study and, in general, the validity of the results. Now, finally, these barriers may all be even more pronounced in our CTN trials, where participants generally have a current or previous substance use disorder. Now, it's a common idea that assessment burden impacts retention, so the more assessments you have and the more the participants have to sit for 4 or 5 hours of answering questionnaires, that would impact retention. But Paul Joachim and colleagues found that this was not necessarily true in our network of studies. They examined 24 trials that were conducted in the CTN between 2001 and 2010 and found that the relationship between assessment burden and the length of the trial and retention was neither as direct nor as strong as anticipated. So the question is, what can we do to improve retention? We know it's important, and it's especially important in our studies. We know it might not be so strongly related to the length of the trial or the assessment burden. So what do we do? And this is what our presenters will talk about next. So with that, let me introduce Frankie Kropp and Mitra Lewis, who will be presenting on the Cheers principle of participant retention. Phoebe Gaucher and Dagmar Salazar will present on the use of the locator form as a retention tool in clinical trials.